Cushman Outfitters, I would like to welcome you to the CME OCAST titled The Impact of Racial Disparities on Obesity and COVID-19 Care. This activity is brought to you by CME Outfitters, an award-winning accredited provider of continuing education for clinicians worldwide. This activity is supported by an educational grant from Novo Nordisk. Again, I'm Dr. Robert Kushner, Professor of Medicine and Medical Education at Northwestern University Feinberg School of Medicine. And I'm very pleased to be joined today by my colleague and long friend, Dr. Donna Ryan, who's a Professor Emerita at Pennington Biomedical Research Center in New Orleans, Louisiana. Welcome, Donna.
Glad to be here, Bob.
It's a pleasure to be doing a podcast with you, Donna. We go way back and you have so much information to share, and I'm really looking forward to going over all of this information. Let's begin by reviewing our two learning objectives. After participating in this activity, learners should be better able to describe how disparities manifest in patients with obesity and develop two strategies to address disparities in patients with obesity that contract COVID-19. You know, Donna, you and I have been working in the obesity space for a long time, and this is the first time I can think of where an acute medical problem has been facing obesity, and obesity is contributing to the cause of acute medical problem. We always think of it as a chronic medical problem when we think about working with patients and preventing things that occur downstream. But this is an acute problem right with us. And it's really obesity and COVID-19, these pandemics coming together. What are your thoughts about what's going on here, and what's that link?
Yeah, you know, Bob, I really think the COVID-19 pandemic sort of blew the covers off of the obesity global pandemic. And it shows it for how serious the problem of obesity is. It's not a problem, a cosmetic problem. It's not just about how patients look. It's not just about lack of willpower. It's a serious medical condition. And I think the more severe adverse outcomes with COVID-19 has really reinforced that. You know, it's not just in the United States. Granted, we have 42% of our adult population with a BMI of 30 or higher, but it's a global problem. In the world, the worldwide prevalence of obesity has nearly tripled since 1975. And it's estimated that by 2025, there are going to be 2.7 billion adults with overweight and more than 1 billion adults with obesity.
Yeah, I was just going to say that a lot of people probably don't know that overweight is the most common non-communicable problem. It's not underweight anymore, right? Globally, it's That's overweight.
Right. Yeah. So the two ends of the nutritional disease spectrum, undernutrition and overnutrition. And now the largest number of individuals affected are affected by overnutrition.
Yeah, you know, and you also bring up, and I really want you to talk to me about this, because I heard of this term syndemics, you know, a little while ago, and it really caught my attention that it really describes, I think, very nicely what is happening with COVID-19 and obesity. What is syndemics, and how does it apply to this situation?
Yeah, so syndemic is a sort of a shorthand for synergistic epidemic. We all know we've got an epidemic of COVID-19 around the world. It's a pandemic. And we've got this epidemic of obesity around the world. So obesity and COVID-19 severity and complications are biologically related. There's a synergism between obesity and COVID-19. But this concept of syndemic implies more than that. It's more than just the biologic interactions. It also implies that there are underlying social and societal issues that drive the risk for both. So obesity puts individuals at increased risk for adverse outcomes of COVID-19. I think COVID-19 has also put individuals at increased risk for obesity because of limitation of opportunity for physical activity, because our lives have been constrained and we're all certainly under stress.
hmm this whole idea of this social, the pandemic and the social determinants of health. It's really put a light on this, like more than anything. And we're living, the whole idea of Black Lives Matter and this whole, increased focus on social determinants of health and the underserved and what makes people more vulnerable. This really has brought it up really quite significantly. And the whole idea of the chronic diseases really kind of comes together so nicely in showing this. Donna, so what is it that makes social determinants such a significant risk factor for developing COVID-19 and the obesity?
Yeah, and other chronic diseases too, Bob.
Right.
So the social determinants of health are racial and ethnic discrimination, access to healthy food, access to health care, location, where you live, the physical environment that you live in, your socioeconomic status, your educational level, and then the whole context of your social environment and community environment. And we certainly know that these factors increase risk for obesity. They also increase risk for the chronic diseases like diabetes, hypertension, cardiovascular diseases, and pulmonary dysfunction. And they also increase risk for more serious and complicated outcomes of COVID-19 disease. And furthermore, obesity and the chronic diseases drive risk for adverse outcomes of COVID-19. Mm-hmm. So if we're really going to get this under control, we can't just look at the disease itself. We must address these social and societal issues that determine risk for these chronic diseases and for adverse outcomes of COVID-19. So, Bob, this is a moral issue, I believe. It's not a political issue, it's a moral issue.
Yeah, it certainly gives us this whole COVID pandemic that we've all had this shared experience with has really, I think, really helped us understand the social determinants of health and why it's such a significant risk factor. So I think that's very, very interesting. Don, I want you to take us through a little bit more, though, that we know that a BMI of over 30 is a risk factor for obesity, for developing COVID-19 as a marker of obesity. But what have we learned over this past year about the implications of obesity? Why do these individuals have a greater risk, and what are they actually having problems with?
Yeah, so obesity, BMI 30 and higher, does drive risk for hospitalization, for requiring invasive mechanical ventilation, for ICU requirements, for death. So we know that, and furthermore, the higher the BMI, the more severe the obesity, the greater the risk. So there's certainly a biology that underlies that. And let's go through that first. So individuals with obesity, first of all, are more likely to have all of the comorbid conditions like diabetes, cardiovascular disease, kidney disease, altered pulmonary function, and those things make individuals more susceptible to adverse outcomes of COVID-19. But obesity in and of itself, we need to recognize that there is immune dysfunction there. So there's impaired function of our T lymphocytes and subpopulations of those T lymphocytes. So that early immune response is impacted. And then individuals with obesity and abnormal excess body fat have a pro-inflammatory and pro-thrombotic milieu. These are these pro-thrombotic products of this abnormal fat tissue and pro-inflammatory products. So we know that with COVID-19, one of the complications that can occur are these pro-thrombotic events, these thrombotic events, and these cytokine storms and inflammatory events. And so obesity predisposes to those also. A big factor is endothelial dysfunction, and obesity drives endothelial dysfunction. And so certainly that endothelial dysfunction is a big factor in adverse outcomes of COVID-19. But look, it's not all biology. You know, individuals with obesity are subject to stigma, and they may delay their health care because they don't feel welcome in a healthcare environment. And, all of those societal and social factors and social determinants of health come into play. So individuals who are minorities, who have obesity, are more likely to be lower socioeconomic status. They're more likely to be in those caring professions. So they have more likely to have occupational exposure. Their neighborhoods tend to be more crowded. There's more exposure through crowded living conditions. So biologic reasons and social reasons that individuals with obesity really do suffer adverse outcomes of COVID-19.
Yeah, I think you underscore so nicely, Donna, that it's not just a BMI, it's just not a number that puts someone at risk. It's actually the disease of obesity, which you outlined so beautifully, the inflammatory risk, the cardiorespiratory risk that sets up individuals for complications along with the social factors. So you really highlight that very nicely, why someone with obesity, disease of obesity, is at increased risk. So Donna, we all know you're from New Orleans. Everyone knows you're from New Orleans. You got the New Orleans accent. you wear it so well. But
wait a minute, Bob. You're the one with the accent.
But I know you have a clinical perspective from New Orleans to kind of bring to light the meaning of what it is to have obesity and increased risk of hospitalization. I wonder if you could just walk through that clinical perspective for us.
Oh, thank you, Bob. It's true. I love New Orleans. I think it's Mecca. There was a most interesting study published in the New England Journal of Medicine by Ebony Price Haygood, one of my colleagues at Tulane. And she looked at the Ochsner Health System. Now, the Ochsner Health System is our largest health system in the city, and African Americans or Blacks comprise about 31% of their patient load. There were 3,626 patients who tested positive for COVID-19 in that health system. And interestingly, 76.9% of patients hospitalized with COVID-19 were Black, compared to 31% of the overall population. And if you look at mortality, 70.6% of those who died were Black. So this is a great preponderance of susceptibility to adverse outcomes of COVID-19, to hospitalization, to death from COVID-19. What is causing that racial disparity? Well, what I like about this study is they did regressions and they looked at different factors that could account for these adverse outcomes. So what they found was when they adjusted for the type of insurance, were you on Medicaid, were you on private insurance, were you on Medicare? When they adjusted for the type of insurance, residents in a low-income area, whether you were Black or white, clinical markers of more advanced disease, there was no difference in race in terms of need for hospitalization or for mortality. So I think it's important to recognize this so beautifully illustrates to me that the social determinants of health are so important, and it's not just race, and that we really need to provide, regardless of race, an environment where access to health care, access to education, access to healthy environments is available for all.
Yeah, thanks, Don. That was a wonderful study and a great summary of the social determinants of health that we need to think about so much in all healthcare settings and all the diseases that we treat. Don, I want to end up now with the whole idea of vaccination. We're coming towards the end of this, thank God, this shut-in pandemic. And there's been a lot of questions about individuals with obesity, do they get less benefit from getting vaccinated? So what do we know about vaccines and obesity?
Yeah, this is so important. And my city is lagging behind in vaccination. So I want to get the word out there about this. So, do persons with obesity benefit from vaccination? And the answer is a resounding yes. So, here are the three vaccines that are available in the United States right now: the Pfizer BioNTech vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. So, in an analysis, if you go back and read the papers and the supplementary materials for the paper, they did subgroup analysis according to BMI and looked at vaccine efficacy. And so there was no difference in vaccine efficacy according to whether you had obesity or no obesity for all three of these vaccines. These vaccines they're highly effective in not only preventing disease, but if you do happen to have the disease, it's much more likely to be asymptomatic or very mild. Their value really is preventing complicated disease and preventing death from COVID-19. So we really need to encourage all of our patients and not let obesity be a barrier to getting that vaccination.
Good. Well said. Bottom line, everyone get vaccinated to stop this pandemic. I want to end up this podcast by just going over SMART goals. SMART goals stand for specific, measurable, attainable, relevant, and timely. And this is what we use when we talk about behavior changes with individuals. But I'm going to use SMART goals for you as listeners as takeaways. I want you to assess the exponential risk of poor outcomes for patients with obesity infected with COVID-19. I want you to recognize the disproportionate morbidity and mortality in patients with obesity from communities of color that Dr. Ryan summarized just so nicely. Consider and address social determinants of health when providing patient-centered care for patients with obesity who are at particular risk for poor outcomes if infected with COVID-19. You want to assist patients with adaptive coping skills to improve nutrition and exercise, and consider medications for obesity when appropriate. And lastly, as we just said, encourage your patients to get vaccinated. I want to thank you, Donna, for being part of this important discussion, and thank you to our audience for joining us. We hope you found the information useful and applicable in care of patients who are in your own practice. Thank you again for participating.